Is it playing now?
Yeah, here we go. So I'm going to be doing a deflating the balloon. So this here is a nightmare. We've had blood again.
Because last time it fell out.
Yeah, it has fell out. So I'm just going to see if I can get a video for obviously stats for future on Ben, because this has been a nightmare. So I'm going to try and do my best. Keep that up. I don't know where to put the bloody thing.
Stick it there.
I don't know whether it'll show.
It'll just show you.
I know. Well, no, I need it to show your actual procedure. So it is a nightmare of a procedure.
Of course it is.
So I've got 500 mils. This morning we've had blood. So I'm going to rise the bed. I've sterilised everything. I don't know what else to do. I really don't.
I'm still bypassing.
And yeah, he is bypassing. I've got the ventilator ready because we're going to go to bed. He's going to go, well, I need some sleep. He needs to sleep. I need to sleep. So what I've done already is I've put some instiller gel down there. I'm going to pull my mask down because I can't handle it. Just as long as my spit don't go in there, I'm not really bothered. I'm going to use a clinical wipe on my hands. And see if I can get this done quickly because he's
Yeah, it keeps going up and down.
AD is up, down, 166, 118, 170. It hasn't gone any further than that, but I don't want it to get any further. So obviously here is all sterilised, the whole lot is sterilised, but this is a dirty at the moment, what we class as a dirty area. So what I'm going to do is I've got the clamps, and I'm going to clamp the catheter just to this pad a minute, just so I don't mess with it and it doesn't drag. So while I do this deflation, so here we go.
There's the empty syringe.
Yeah, we'll soon see. So pop it into the nozzle. I'm not even sure if you can see on that video. I don't need that sterilised, I just need that sterilised pack there. So in I go. I'm going to draw back as quickly as I can and see what the hell's going on and how much water we've got in there. Which looks like...
How much?
You will not believe this. How long's this catheter been in?
2 weeks.
So again, another catheter that's been in 2 weeks. I have got him on antibiotics.
And how much water's in it?
Just about to see now.
It's missing loads.
Nah, it's only missing a mil.
What?
Yeah, it's only missing 1 mil. So that's not bad. So what I'm going to do now
Just push it in.
is pop it back in. I've cleaned the area, like I said. I'm just going to try and get a glove on, if I can. If I can't, I'm just going to have to do it without, because sometimes you've got to be really quick at this and you haven't got time for sterilising. You alright?
I'm alright, yeah.
So I've already got my 10mm syringe. I've done that. And what I'm going to do now is mess about. I'm going to hold his leg with my arm. I'm going to open him up there, and I'm going to open the stoma like, pinch it open. Take a breath. Ready? 1, 2, 3. I'm going to see what's going on. So I'm giving it a little tug and a little pull, and I'm just going to pop it, see if it'll go in. Breathe, breathe, breathe. You all right? Yeah? Yes or no?
Yes.
And then what I'm going to do is try and get the balloon in and use my body to do it.
That was definitely out, I think.
It is out. It was out by a few centimetres. So the balloon's just been blown up right now.
That's why it won't work.
Lock off, like, so you lock off, tuck that away. And then what I'm going to do is give it a little, I don't think you can see by there, but I'm going to give it a little tug.
Don't give it too much of a tug.
No, I'm not. But I've got a complete flow.
Oh, relief. Thank God.
Sorry, Ben, but you know, it's been a nightmare.
I did say to you about the balloon.
I know. So I've got some saline, so what I'm going to do is give it a wipe with some saline. So you be really gentle and you only sweep around the area once and you sweep around the other area once.
I feel
You do
much
not
better now.
cross-contaminate it.
No,
But we are going to we're going to sleep because this has just gone on for too long.
it's killed us.
I don't think it's killing us, but it's tiring.
It's killing you because it keeps happening.
It's not killing me, is it? So I've got no blood, no nothing. I just need to clean the area up where obviously what happened is I got urine coming out of the stoma as well as the penis. So it's kind of like I've got to fault find as much as possible. If this catheter don't work today, then I'm going to take it out, put a new one in, and call the hospital and ask them for help, because that is it with me. So let me get this glove off. Let me get that glove off.
I reckon we just had a bad batch, personally.
We have had a bad batch where the balloon's just not worked. So what I'm going to do now is I'm going to take a reading. How you feeling?
My reading's gonna be fine.
How you feeling?
Good.
Okay. So
Really
I've
good,
got
yeah.
another alcohol wipe first. I'll wipe my I'll wipe my hands because I haven't got nothing else at the moment to wash my hands with. So at the end of the day, as long as my fingers and my hands are clean. You alright?
Yeah,
Let's get that reading then.
much better.
Messy job, but it looks cool. I'll
It's
show
flowing
you.
like a bastard now, I think.
Mask down. How you
Flowing
feeling?
really good.
So he's reading. I'm going to do a reading. So let's get a reading for him. Please God, give us a good reading. So his heart rate was down. It was yesterday it was 44, but he had bloods done and they couldn't get the blood out of him. He's got to go to hospital to get that. So his heart rate's gone to 60, so that's cool.
Yeah, well, that's pretty juicy.
I've just seen a quick brief one. I haven't done his stats because I just haven't had time for it. You've just got to work quick. So we wait for that reading. Actually, while we wait for the reading, I'll show you, Ben. This is the mess on the bed that you have to deal with. So even though it doesn't look clinical, this is all the clinical bit and the sterilising bit. But you know, it becomes void after you touch it. So I just want to show you. I'll lift his tummy up. How clean that is. There's no smell. So I've got no offensive smell. I've got no overgranulation. But what I have got is still a bit of a high reading, which is 171. So I'm going to watch that now for the next 10 minutes. I'll do 2 more readings. However, what I have got is a flow. So that's what I'm saying about clamping, so that the clamp does not pull that catheter in any way, shape or form. And it's warm to touch, so that's lovely. And there's nothing in the bag, so I'll do that. And in the night bag, we've still got 500, or just over, I'd say 600 there. But obviously all the way up is a flow, is urine. All the way to the end, to the stoma, I've got urine. And I haven't got any gloves right now to touch that tubing, but I will make sure it's warm. So I will do another reading now, and you're going to go on your vent, aren't you? So because he's been so tired over this, I need to ventilate him, so that's what I'm going to do right now. So that is what I mean by popping back, trying to see if I can pop back and let it stay in situ. Make sure that we haven't got overgranulation in there, because that's another thing that happens when you've done catheter changes too much. So another reading should make him okay. But it's 52 his heart rate. So I'll just keep checking. Hang on.